Professor Davis here, and we are now going to look at part 2 of the cardiovascular and lymphatic diseases. In this case, we're going to focus in on the viral as well as the protozoal and worm infections. So the viral diseases that we are going to look at are going to be the Burkitt's lymphoma, infectious mononucleosis, cytomegalovirus, and hemorrhagic fevers. These hemorrhagic fevers include things like yellow fever, Ebola, and hantavirus. So let's look at Burkitt's lymphoma first. Burkitt's lymphoma is linked to a prior exposure to the Epstein-Barr virus infection. We do see that it is a mosquito-borne malarial infection as well that can cause this to develop because it weakens the immune system. And when it weakens the immune system, it allows for the virus to explode, be opportunistic, and cause damage. All right, so this is going to be pretty rare in the United States due to the fact that we don't have a lot of malarial infections, but we do see that it can become a problem in AIDS patients when the immune system has already been compromised. It's just not being compromised by a malarial infection. We see that this is the most common childhood cancer in Africa, and it is linked to that viral infection of the Epstein-Barr, but also subsequent infections due to malaria. The next one we have is infectious mononucleosis. Infectious mononucleosis is caused by the Epstein-Barr virus. We do see that transmission is through saliva, so a lot of times this gets termed as the kissing disease. It is the human herpes virus 4 that causes this. That's what Epstein-Barr virus is. In children, a lot of times mono is asymptomatic. They don't even realize they have it. It doesn't really affect them at all. But symptoms are most pronounced in young adults in the ages of 15 to 25, and this is due to the intense immune response that takes place. We do see that we have fever, fatigue, sore throat, and swollen lymph nodes that can occur as your basic symptoms, but there are going to be some complications that may occur, which is what we see with this splenomegaly. This is an important complication to look at because it's an enlarged spleen, and the spleen is an area that has a big reservoir of blood. So if this is a complication, the patient is needing to be limited on their activities in order to reduce the chances of rupturing the spleen, because then they can bleed out really quickly due to that reservoir of blood. Most people have antibodies to Epstein-Barr virus by the time they are age 50. Okay, it's going to be common for most people to have it. So if you look here, Epstein-Barr virus, we do see that it can happen in lots of different ages, but the ages from 15 to 25 are where you see most of the symptoms. They're very symptomatic there. Now, with infectious mononucleosis, there is a rapid serology test that we can do for diagnosis, but we can also do a blood smear where we're looking specifically for what we call atypical lymphocytes, known as Downy cells as well. The next one is the cytomegalovirus, or CMV. This is also known as human herpes 5. We see that most have been exposed before the age of 20 to cytomegalovirus, and you have no to mild symptoms normally when that occurs. The at-risk populations are going to be the immunocompromised. This is where complications can occur. These complications could include things like encephalitis, retinitis, which is going to be inflammation of the eye itself, pneumonia, and it can even cause gastroenteritis. Another at-risk population is a developing fetus or newborn baby, and this is due to a primary exposure that happens during pregnancy. It increases the chances of mental retardation and hearing loss. When we look here, this is going to be the ages that are going to be important to test pregnant women to see if they have antibodies for CMV. That way, that helps fight an infection and protect their baby if they have already been exposed. Cytomegalovirus is an enveloped virus, which you can see here in the picture. You will also see that it is a DNA virus, and it includes, or it forms what we call inclusions that look like owl eyes when we look at it in tissues. All right, and so we can see them located here where they look like these inclusions or owl eyes that are present. The The next one we want to look at is hemorrhagic fevers. Hemorrhagic fevers are things like yellow fever. This is caused by arborovirus. We see the last case in the U.S. was in the 1900s, specifically 1905. We see that vaccines do provide really good immunity against this one. And we also see that we've worked to try to have more vector control. The vector here is the mosquito. We see that the symptoms are fevers, chills, headaches, nausea, and vomiting. The yellow comes to the fact that you tend to have liver damage and it causes you to be jaundice. Okay, so the skin starts to turn more yellow. That's why they call it yellow fever. The next one of the hemorrhagic fevers is Ebola. Ebola, we see that it had its emergence in the U.S. in 2014. It is endemic to Africa, but we do see that it came over to the United States due to air travel, especially air travel of medical professionals who were going over to help treat and help patients with Ebola. It is transmitted in body fluids, and it does have a hemorrhagic rash that appears over the entire body. And eventually it's going to affect the organs by weakening the blood vessels and causing them to rupture, and this causes them to bleed and causes organ damage. The next one you have on here is the hantavirus. Hantavirus is frequently fatal because of the fact that it causes fluid to fill in the lungs, and it can also cause renal failure. This is going to be where mechanical respiration is going to be super important, like putting them on a ventilator to try to help remove the fluids and let their body tissues rest in order to hopefully heal and overcome hantavirus. We also see they will use the antiviral ribavirin to help with this against hantavirus. Now, hantavirus is carried by deer mice. And we see that you don't have to be in contact with the mouse itself to get this. It's the droppings of the mouse. And so if the mouse ends up being like in your garage or something like that, and then you go in there and you start sweeping, okay, after, and the dust gets knocked up and you breathe that in, you ultimately could breathe in this hantavirus and become infected. Hantavirus is typically found in New Mexico, but it's found in northern New Mexico, not southern New Mexico. The next one we want to look at are the protozoan diseases. The protozoan diseases are going to include chagogs. We also have toxoplasmosis, malaria, and leishmaniasis. Now, one thing to note about protozoan diseases is their life cycles are very, very complex, which means there's normally going to be a reservoir and a vector that transmits them. So the first one here is the chagogs disease. The reservoir is going to be rodents and possums. The vector is what we call the Rudvilli bug. This bug is also known as the kissing bug. Transmission is going to be that while it's feeding on your skin, like it feeds and gets the blood and stuff like that, it defecates and it gets into the scratches that it creates, and it then infects you. This is a type of protozoa called a trypanosome. It's a trypanosome hemoflagellate, meaning that it likes to be in the bloodstream and it has flagella. We see that this is common in Central America and South America. It kills about 50,000 individuals annually. It is going to cause some chronic cases, which causes them to be very difficult to treat. And it causes damage to the nerves controlling peristalsis. So the movement, we talk about peristalsis, it's the movement of food through your digestive system. Now, chagogs is spreading. We see that it's mostly going to be an issue in Central and South America, but it has come across, and there have been cases reported in bordering states, and there have been cases as high as Illinois as well. The next one is the Toxoplasma gondii. This is going to be where the protozoa is a sporozoan, meaning it doesn't move on its own. It doesn't have flagella, cilia, or it doesn't use a false foot as the pseudopod. We see that you can have no to mild symptoms if you are infected here. And we do see the people who are at risk of developing complications of this type of infection are, again, immunocompromised and newborns. And we see that it is transmitted via cat feces. And so we see that through rodents and different things like that, which are intermediate hosts. It can enter into the cat, and then the cat can shed it through its feces. we are unintentionally affected due to cleaning out the litter box. And so this is one reason why women who become pregnant are told not to clean out the litter box, because it doesn't really affect them, but it can affect their unborn child. It can cause neurological and vision impairments to occur. There is a serological test that is available. So let's take a little closer look here. A fetus may contract toxoplasmosis through the placental connection from an infected mother. The mother might be infected by improper handling of cat litter, handling or ingesting contaminated meat as well. So it's important that pregnant women are very careful in order to not unintentionally infect their unborn children. And we can see here that this is where the most common infections do occur is going to be in those ages of pregnant women. And normally there's about 20 to 40% of individuals who already have antibodies at this time against toxoplasmosis. And it can be severe enough, guys, to cause stillbirths. Okay, the infection can be severe enough to cause stillbirths. The next one are the Plasmodium. These are going to also be a sporozoa. Plasmodium is going to be the cause of malaria. And we see that it causes the individual to have spells of chills, fever, and headaches. The reservoir is humans, but the vector is through the mosquito. And you can see that it's going to be located in the bloodstream. So diagnosis is looking at the blood for the presence of the sporozoa. And it is important for the timing of the blood draw due to its complex life cycle. Now, there are several types of plasmodiums that are going to cause disease in humans. The Vivax is relatively asymptomatic. You don't have symptoms, but it is the most prevalent. It's the one that people get infected with the most. The ovule is relatively asymptomatic too, but it's not as prevalent. The malariae is relatively asymptomatic and not as prevalent, but the falciparum is going to be the most symptomatic, and it also has the highest mortality rate if left untreated. A lot of times in these untreated people who have malaria, they start to have what we call black water fever, which means they have dark urine due to their red blood cells being hemolyzed. Their red blood cells are just being destroyed. And so the urine starts to turn this dark, kind of almost blackish red color. Here is the geographical distribution of cases in the U.S. due to travel. And a lot of times this has to do to travel to a lot of the endemic areas. And so if somebody's going to travel to a lot of these countries that are prone to having malaria, there's some prophylaxis treatments beforehand. Chloroquine is the example, but chloroquine can have some very high psychiatric side effects, meaning that it can cause depression and hallucinations for years after it's used. Now, this doesn't happen for everybody, but it can occur. If you are exposed to malaria and have it, there are some anti-malarial chemotherapeutic agents that are available as well. Now, here is a picture that just shows you how complex the life cycle is for malaria. You don't need to memorize this and know this for my particular class, but I want you to see that their life cycle is very, very complex. The next one we want to look at is leishmaniasis. Leishmaniasis is a protozoal flagellate, so it has the flagella to it. Leishmania is going to be having a variety of different species, but we do see that we diagnose it by scraping off some of the superficial lesions and then testing it to see if it's present. The vector of who transmits this is the sandfly, and these guys are smaller than mosquitoes. So they're smaller than mosquitoes and they do bite. And this causes them, because they're smaller, they are able to get through a lot of times those mosquito nets that we use in countries where they are present. The reservoir are going to be the small mammals who carry it, and then the sandfly is the vector, and it is transmitted through the blood. So when we look at leishmaniasis, there's the cutaneous form. This is the most common. It causes ulcerations on the skin that do result in scarring. It's also known as an oriental sore. Oh, there's a mosquito in here. This is also known as an oriental sore. We see U.S. troops really got a lot of these during the Persian Gulf War. They were exposed greatly at that time. We also have the mucocutaneous form, and this can be disfiguring, where it gets into the mucous membranes and it disfigures those structures like the nose and even the mouth. And then there's the visceral form. This is also known as kala azar, and it's often fatal in 1 to 2 years. Now, this particular disease is endemic to Southern Europe, Spain, Italy, and Portugal, as well as some other areas you see in yellow around here as well. Now, there are different types shown in the green, the yellow, and the red. The next one we want to look at are the worm infections. With these, there are 2, and they are both types of flukes. Since they are flukes, this means that they are part of the flatworms, which are the platyhelminthes. This first one is schistosomiasis. This one is created or caused by a fluke, which is the platyhelminthes. Infective stage is shed by snails, which are the intermediate host, and they enter through skin abrasions. Now, prevention is good sewage and water treatment plants, and we see that they do migrate via your capillaries to organs like your liver, your bladder, your intestines, and your lungs. And you can actually see one growing inside of this particular structure. And you can see as they opened up the organ, you can see the flatworm. Now, flatworms doesn't mean they have to be small. They're just meaning that they're flat in their structure. So if you look here, again, this is to show you that the life cycle is very extreme. It's very complex. We see that we can ID it by its egg form. And remember, the snail is its required host in order for it to get into humans. Now, the snails that actually are the main host for this, the species, they are not found in the United States. The last one we want to talk about is called swimmer's itch. This particular case, this is a rash caused by an allergic reaction to a fluke that burrows into the skin after swimming in infected waters. So the fluke burrows in and your immune system responds, and it creates an allergic reaction, this rash. Now, it's only skin deep, but itching does subside with time. It does bother you. It does cause a lot of itching. But humans are a dead-end host because you were unintentionally infected. The blood fluke that infects birds and other mammals, and it doesn't want to infect you. So ultimately, your immune system does destroy it, and it's removed because it doesn't want to continue to infect you. But this is known as swimmer's itch. Now, this finishes up our 2 lectures over the cardiovascular and lymphatic system. So again, if you have any questions, please let me know.